Hey everybody, we're going to be talking today about doing some filler in the lips. I think this is one of the areas that has a lot of important considerations. A lot of people are really scared about getting filler in the lips because they've heard stories about how much it hurts, or that they had to get a dental block with lots of injections and their face was numb for hours after. And if there's one thing I can think of that's really sort of revolutionized my cosmetic practice, it's been blunt cannulas. Whereas before we had blunt cannulas, people would be looking at 5 to 10 needle sticks around just on their upper lip and several more on the bottom lip below. What we've been able to do with the blunt cannula is use 2 sticks on each side of the lip and then a blunt cannula to actually thread the filler in, which has really done wonders for patient comfort. It also is really great in that it's reduced the amount of bruising that people used to get. As the lips have a very rich blood supply, they're very sensitive, and so they are very susceptible to both pain and bruising. The blunt cannula has really been just a revolution in doing fillers, and it's just a very small little, looks like a needle, but you can put your finger right on it. It doesn't hurt. If you come up against a blood vessel, it will actually push those out of the way as opposed to going into the blood vessels. The other nice thing about the cannula is that it makes the procedure more safe. There was always a risk with putting filler anywhere in the face that you could get into a blood vessel and inject filler into that area, which would cause the blood vessel to clot off, which could lead to what's called necrosis, where actually the tissue can die. And using the blunt cannula, it's almost impossible to do that. So that's just really been another great benefit from doing the blunt cannula. With me, my whole goal with this procedure is to make it as comfortable as possible for the patient. So we use a numbing cream that I've had a compounding pharmacy make up for me. We leave that on for about 30 minutes before the procedure. We use some ice beforehand, which also helps with swelling afterwards. And then one of the other, and the blunt cannula obviously, which I talked about, and then the last piece of that is just using a gentle technique when you inject. I'm a trainer for Allergan, and I've gone around and taught a lot of people how to do injections properly, and one of the things I see a lot is that some people use a stabbing or a jabbing motion when they're injecting, and that really results in a lot of discomfort for the patient. So I think taking your time and really having a gentle technique with patients, using the numbing cream, doing all the things that we can to make the procedure as painless as possible really pays off in the end. So we're going to be doing Laura Beth's lips today, her upper and her lower. She's had this procedure done in the past and has had really great results. So she's back for more today. We'll be using a little bit of Juvederm. The nice thing about Juvederm is that it has a lidocaine mixed in with it, which once again helps with patient comfort, so that as you're injecting, you're actually numbing the area a little bit. And I find that really has been great. So having a product that's already pre-mixed with lidocaine in it has been just wonderful for here, because we can reach across. As you can see here, this is the blunt cannula. You make a small spot right here to get in. We can reach across about halfway. We'll do the same thing from the other side. So it's really just this one little puncture that we need to make. And she's had numbing cream on for a while and some ice, so hopefully that's really going to help. We'll just find out. Here you go, Laura Beth, little pinch here. Yep, that's the worst part. And I thread it out just a little bit.
necessarily right on the line, just right below it, which I think gives a natural look. And then I usually come back. I like to put a little more right at the Cupid's bow right here to give the lips a little bit of perkiness. And that tends to roll the lip out just a little bit as well. You know, there's a lot of bad press about people having the trout pout or duck lips or things like that, and I think the reason is that people lose the aesthetic of the lip, which if you really sit down and look at what are nice looking lips, you have to remember that the bottom lip is crucially important. And if the top lip juts way out over the bottom lip and it's not balanced, it looks unnatural. So I always put a lot in the bottom lip to get it to pout out below the top lip, which I think looks a lot better. Most of my patients like that look too. So I'm just kind of feeling with my finger and how much we've gotten in here, and that's looking pretty good for that side. And the other important thing, let me back out there, that I always do is massage afterwards, and that's the nice thing about this product is you can kind of mold it. So we just gently massage it and get it where I want to go. Look towards me. Yeah, that's good. We can see a nice difference between the two sides there. Good. All right, well, we'll do the bottom lip next since I'm already over on this side. Bottom lip is more sensitive. Always is. Laura Beth has a little teeny scar right here, which you can probably see. So that we have to be careful about that because that tissue is not going to be normal. It's a little bit tethered down. So usually I fill around it and move it around with my fingers a little bit. So we'll make a little pinch here. 1, 2, 3. Good job. Now I just mark that spot. This is the hardest part of the whole procedure, is getting to rethread into that hole, but we jumped right in there. There's usually a little bit of tissue give as we go across. Yep, that's going across the scar there. Sorry, Laura Beth, you're doing great. Okay. Yep. Once again, we'll go slow here. This is where we want to give the bottom lip a nice little pout. Really balance it out with the top. I think it looks great. Inject slowly. Usually I move around a couple little planes here. Fill around that scar. Great, good job, Laura Beth. I'm backed out just a little bit there. That's good. We're going to massage again. Right, you can probably pause right there. One more to go. We're almost done. Last little puncture here on this side. 1, 2, 3, Laura Beth. Good job. Perfect. And I usually keep that needle there just so I can mark it with my eyeballs, because it's such a tiny hole, it's easy to lose it when we go to get back and thread this back in. There we go. A little pressure and we're in. Well done. Okay. And just like before, we come across to the top here and inject slowly. The other thing I do with the cannula is kind of feel with my finger so I know exactly where it is. Feel the tip of it and I know what plane I'm in. You don't want to put any of these fillers too superficially because they'll do what's called the Tyndall effect, and you may have seen it can look like a bluish hue where the light shines off of it, and so it doesn't look very natural. Injecting slowly. Almost done. Just come right back out there. Blot, just that little dot. Sometimes you get a teeny bit of bleeding. It stops pretty quickly with some pressure. And do a little massage here again. All right, you can stop there. So that's Juvederm using the blunt cannula technique into the lips. Once again, some of the things we try to do to make this really comfortable is using the numbing cream ahead of time, ice, the gentle technique, and the blunt cannula, which all I think makes a really big difference. And we'll get Laura Beth to give a few words about her experience afterwards. If you have any questions, look us up on our website, www.travisshawmd. Our phone number is 804-775-4559. Thanks so much for watching, and we hope to see you on some more of our videos.
Can you describe your experience with being injected with Juvederm in your lips today?
So today I got my lips injected with Juvederm by Dr. Shaw. We put a topical numbing cream on for about 30 minutes, and I held an ice pack on my lips for probably 5 to 10 minutes before he came in to inject my lips. On a scale from 1 to 10, I would rate the pain a 3. You know, the initial prick of the needle before he actually goes in with the blunt cannula is the worst part. Once he's actually in the lips with the blunt cannula, the only thing that you really feel is a little bit of pressure. Sometimes or in the past actually, I've had it sting just a little bit. But once the lidocaine, because it's mixed with the lidocaine, it really goes away fairly quickly. And like I said, it's a 3. It's definitely tolerable to be done in the office. We didn't do a dental block or anything like that today. We just used the numbing cream and ice, and it was a fairly quick procedure, and now I'm really happy.